Today, we're diving into a topic that is incredibly important for all of us in the complementary and alternative medicine space: understanding conventional medicine. Now, I know what some of you might be thinking. Aren't we on opposite sides? The truth is, we're not. We're all part of a larger ecosystem of wellness, and the more we understand each other, the better we can serve our clients. Building bridges, not walls, is the key to providing truly holistic care. So grab a cup of tea, get comfortable, and let's explore how conventional medicine works, what its strengths are, and how we, as complementary therapists, can work alongside it to create the best outcomes for the people we help. First, let's demystify the term conventional medicine. You might also hear it called allopathic, mainstream, or Western medicine. At its core, it's the system of healthcare most people are familiar with. It's what you find in hospitals, clinics, and your local GP's office. This system is heavily rooted in science and evidence-based practice. The guiding principle is to identify a specific disease or ailment and then treat it directly, often using pharmaceuticals, surgery, or other targeted interventions. Think of it like a highly skilled mechanic for the human body. When a specific part is broken, conventional medicine has incredibly powerful tools to fix it. Its diagnostic methods are a major strength. Things like blood tests, X-rays, MRI scans, and biopsies allow doctors to get a very precise picture of what's happening inside the body. This precision is crucial for identifying serious conditions like cancer, heart disease, or infections that require immediate and aggressive treatment. When we talk about treatments, they generally fall into a few key categories. First, there's pharmacology, which is the use of drugs. These medications are developed through rigorous research and clinical trials to target specific biological pathways. For instance, antibiotics are designed to kill harmful bacteria, while statins work to lower cholesterol levels in the blood. Then you have surgery, which is a physical intervention to repair, remove, or replace damaged tissues or organs. From setting a broken bone to performing a complex heart bypass, surgery is a cornerstone of emergency and life-saving care. There's also a vast range of other therapies, like radiation for cancer and physical therapy to restore movement and function. The strength of this approach is its effectiveness in acute situations. If you're in a car accident or have a sudden heart attack, there is no substitute for the emergency room. Conventional medicine excels at crisis management and treating diseases with clear, identifiable causes. But like any system, it has its limitations, and this is where our role as complementary therapists becomes so vital. Conventional medicine often focuses on the disease itself, sometimes at the expense of treating the whole person. A doctor might have only 10 or 15 minutes per patient, which makes it challenging to explore the complex interplay of lifestyle, diet, stress, and emotional well-being that we know contributes to health. This is not a criticism of doctors. It's a feature of the system they work in. It's a system primarily designed for disease care, not necessarily for wellness promotion or the management of chronic conditions that don't have a simple, single cause. This is the gap that we can help fill. We have the luxury of time with our clients. We can explore their stress levels, their sleep patterns, their nutrition, and their emotional state. We help them connect the dots between their life and their health in a way that the conventional system often isn't set up to do. So how do we build that bridge? The first step is communication and respect. It's crucial that we, as complementary therapists, understand and use the right language. We are not curing diseases. We are supporting the body's own healing mechanisms. We are helping to manage symptoms, reduce stress, and improve overall quality of life. Using responsible language not only protects us legally and ethically, but also builds trust with medical professionals. When we speak about supporting a client's well-being alongside their medical treatment, doctors are much more likely to see us as allies. It's also our responsibility to be educated. We need a basic understanding of common medical conditions and treatments. If a client tells you they are on blood thinners, you need to know which of your therapies might be contraindicated. This knowledge is non-negotiable for client safety. It's about being a responsible professional. An acupuncturist might help alleviate the nausea. A massage therapist could provide gentle touch to ease anxiety and muscle tension. A chiropractor or osteopath can work on structural alignment. A yoga therapist can teach gentle movements to improve flexibility and strength. A hypnotherapist can help reframe the brain's perception of pain. We work on the underlying factors, the muscle tension, the inflammation, the stress response that contribute to the chronic pain cycle. By working together, the client gets the immediate relief they need from conventional medicine, while also building long-term resilience and self-management tools through complementary care. The goal is an integrated approach, where the client is at the center. To be effective collaborators, we must encourage our clients to maintain open communication with their doctors. Always ask them, "Have you discussed this with your GP?" Or, "Is your specialist aware that you're seeing me?" This transparency is key. It ensures the client receives safe, coordinated care. We should also never, ever advise a client to stop their prescribed medication or go against their doctor's advice. That is outside our scope of practice and can be incredibly dangerous. Our role is to complement, not to replace. Think of ourselves as part of a team. The doctor is the team captain for the disease, and we are the wellness coaches, helping the client stay strong, resilient, and positive throughout the game. So to wrap it all up, let's stop thinking in terms of us versus them. Conventional medicine is a powerful and necessary system that saves lives every single day. Its strengths in diagnostics and acute care are undeniable. Our strength as complementary therapists lies in our holistic, person-centered approach. We have the time and the tools to address the lifestyle, emotional, and energetic factors that underpin true wellness. By understanding the conventional model, respecting its role, and communicating professionally, we can position ourselves as invaluable partners in healthcare. We can fill the gaps, support clients through difficult medical journeys, and empower them to live healthier, happier lives. Together, we can create a future where integrated care is the standard, and every client receives the best of both worlds. Thank you so much for joining me today. I hope this has been a helpful and empowering discussion. If you have any thoughts or experiences on this topic, please share them in the comments below. I'd love to hear from you. Don't forget to like this video if you found it valuable and subscribe for more content on building a thriving and responsible practice. I'll see you in the next one.